Assalamu alaikum. I would like to welcome you all to the day second of Future of Dentistry International Virtual Dental Conference. The theme of today's session will be Safe Dentistry. I'm Dr. Muhammad Samir Shafi, Chairman of the Infection Prevention Control Foundation. I'm a practicing nephrologist based in Chicago, USA. Let me thank all our partners in making this conference a reality in this challenging times of COVID-19 pandemic. I would especially like to thank Dr. Aqib Mudassar from Next Level Dentistry, Dr. Adnan Shah, Professor of the Oral and Maxillofacial Surgery at University of Manitoba, Canada, who is the chairperson of the conference, OSAP USA, represented by Professor Eve Curry from University of Pacific, Pakistan Dental Association, represented by Dr. Mahmood Shah, President, and Dr. Adnan Johan, President-elect. University Health Sciences, represented by Distinguished Vice Chancellor, Dr. Javed Akram. Temple University, Philadelphia, represented by its Dean, Dr. Amid Ismail. International College of Dentists, all the distinguished speakers from Pakistan and other countries. Last but not least, I want to thank all the professors, principals, dentists, and other professionals who have supported us in this cause. Let me introduce Infection Prevention Control Foundation to my audience. Infection Prevention Control Foundation is a registered non-for-profit organization both in USA and in Pakistan. It is registered under 501c status in USA and registered with Security Exchange Commission of Pakistan. The foundation is striving for a paradigm shift in the healthcare system of developing countries by focusing on preventive health. IPEC Foundation aims to play the role of a leader of preventive health in the third world countries. Our mission is to reduce the burden of infectious diseases from the developing world through the capacity building of healthcare providers, improved regulatory mechanisms, introduction of effective information technology tools, transfer of latest technology, increased coverage of awareness, collaboration with all stakeholders on a single platform to address global health challenges of infectious diseases. Our motto is prevention is better than cure. Our healthcare experience of the past 2 centuries tells us that prevention is cost effective and can be implemented in resource drought countries. Prevention can provide mass coverage of affordable health that treatment can never do. Vaccine, hygienic lifestyle, infection control measured in households, communities, healthcare facilities, and other preventive measures have extended the life expectancy across the globe. Still, there is a lot more to be done. Department of Oral Hygiene and Safe Dentistry was established as an offshoot of Institute of Infection Prevention and Control, which was established under the umbrella of Infection Prevention and Control Foundation. The sole purpose of this department was to ensure safe dental practices and safe dental environment for the patient and the staff, as well as to promote community oral health. As we all know, hepatitis remains a challenging disease in third world countries. Approximately 20 million of hepatitis B and C patients exist in Pakistan, and the number is growing rapidly. Hepatitis B and C, as well as the HIV, is strongly linked to unsafe dental practices. Our plan of action is simple. We want to empower the public with the rightful knowledge about safe dental practices and safe dental environment in dental clinics. It is a challenging task in countries like Pakistan, where literacy rate is low and quackery is rampant. However, I feel it can be accomplished by developing creative tools and using the help of the local community and religious leaders. Social media outlets and other media resources can play an important role in spreading the message of what to look for when going to a dental clinic to prevent the risk of contracting infections. IPAC envisions to build the capacity of the healthcare professionals, including dentists, technicians, and auxiliary staff. It remains our main focus. IPAC strongly believe that more emphasis should be put on infection control practices during academic years in dental school and universities. We aim to bring training workshops and courses to professionals to build the capacity of them. Enforcement of existing regulations and bringing at par with international standards is a key step in promoting culture of safe dentistry. Unfortunately, without a fear of punishment and penalties by state, malpractice will continue to happen and thrive, which will play havoc with the lives of the individuals. We have seen happening in many areas of Pakistan, only to be brought into attention by media. Recent example was outbreak of HIV in certain parts of Sindh due to the use of contaminated needles and instruments. Our foundation will work with the government to offer a partnership for certification of dental clinics, evaluation of dental clinics, and recertification of dental clinics. The list of the certified clinics should be accessible to general public via use of web, social media, and other resources so that they can make the best informed decision to prevent themselves from getting infections by unsafe practices of few. We believe this will promote healthy competition as well as force the healthcare providers to adopt safe dental practices. Dentistry in post-COVID-19 age represents a challenging task for all of us. Dental offices will be treating both symptomatic and asymptomatic COVID-19 patients. Since the incubation period can range from 0 to 24 days, every patient should be considered as a potential infected by this virus. All dental practices need to implement infection control policies, universal precautions, and barrier techniques. Lastly, I want to request all of stakeholders to let's unite under the platform Infection Prevention and Control Foundation for safe dentistry in Pakistan. Inshallah, we'll work together with all the stakeholders to make this dream a reality. I also want to thank you, the staff of the IPAC Foundation, who provided the technical and logistics support for this virtual conference. Again, thank you all. Pakistan Zindabad.